everybody, this is Pallavi Priya Nehru, and today I'm going to give you some information about medical coding as well as medical terminologies, which play a very vital role in studying medical coding. So, first of all, medical coding is the conversion of healthcare related data and diagnosis into numeric and alphanumeric format. All right. So, numeric means numbers, digits, and alphanumeric means an alphabet will be attached with a digit. Let me give you some examples. Say B20, okay, then Z90, you have J44.5, K95. These are what? These are not just codes. These are universal codes for diagnosis, which is implemented in the medical coding process. All right. Now, what are the things you need to study? First, let me tell you the contents. So, contents in the medical coding would be, we start with human anatomy. Okay, all the 13 systems which are included, starting from dermatology till you have endocrinology and blood and lymphatics. All right, so these are some of the sections in anatomy which has been taken up. Next, you have the three set of code books. First one being ICD 10CM, that is International Classification of Diseases, 10th Revision Clinical Modification. That's one code book which codes only the diseases. All the diseases all over the world, whatever is mentioned, it's in your code book. Next would be CPT, that is current procedural terminologies. In that, you code for procedures, surgical procedures, and the most important, different types of surgeries. Okay, apart from that, you have path labs, you have radiology, and anesthesia with ENM, evaluation and management. So that's a 5-digit coding process which is to be studied. Next, and the last third code book is the HCPCS level 2, which is known as HCPCS also. Healthcare Common Procedure Coding System level 2, which codes for ambulatory services, drugs and chemicals. Some ambulance services are also mentioned and coded in that code book. So these are the three set of code books plus the human anatomy, and the last would be a brief description on medical billing. Since you'll be a coder, you should also know how the billing works, how RCM works, and what is your contribution as a medical coder in this whole field of RCM, how you're connected to it. Okay, so these are some of the syllabus contents which you have to study in this whole process. Now, coming to medical terminologies, they are a very necessity and a crucial part of medical coding because it deciphers the medical terms which has been over the centuries provided by the scientists who study anatomy. Okay, they are known as anatomists. And what is anatomy? Anatomy is the study of the structure and form of living organisms. All right, so there are some key aspects of medical terminologies, like they provide you with precision and accuracy. Then you've got efficient coding, because once you know the medical terminologies, then you should be able to understand what exactly the terminologies code for. Okay, so it creates a healthy and understandable relationship and communication aspect between the medical coder and the healthcare provider. All right, so that is one thing. Next, you have prefixes and suffixes. Understanding the root words. Prefixes are the words which are added before with a hyphen. Okay, and there are certain prefixes which are very commonly used, like hyper, hypo. Okay, then there are certain prefixes of negation like a, an, anti. Okay, suffixes which are very important, like ectomy, itis, megaly. Then you've got algia, dynia. These are suffixes for pain. Ectomy is surgical removal. Then you have megaly, which is enlargement. Itis, half of your diseases are based on itis, which is inflammation. Say, for example, dermatitis, cellulitis, conjunctivitis. These are what? These are diseases which you learn to code. You know, the beauty of medical coding is that you don't have to mug up the codes. You just have to understand the guidelines which will help you to code. While you are studying in the training, you'll be provided with the code books, okay, so that you can understand how to pick up the codes while understanding the guidelines. While you're working, you'll be benefited by a software. Okay, they'll provide you with the software in the company so that you are able to code correctly the universal codes. Okay, movement terms. There are many movement terms which falls under this, like adduction, abduction, pronation, supination. Okay, these are very commonly used. Then you have to study the body cavities. Body cavities, there are four major body cavities like cranial, spinal, thoracic, and abdominopelvic. So abdominopelvic is considered to be the largest body cavity in the whole human body because it can house many things. All right, so these are certain points which you have to remember. Apart from that, there's a brief description upon the spine, like how many divisions and regions of spine is there. Okay, so gradually, when you start up with this course, the first and foremost thing would be the description and explanation to these terms, which are a vital and important criteria to study medical coding. So that's all. Thank you so much.